Hey everyone, what's going on? Welcome back to the channel. This channel is a very special episode because we have an interview with Sarah Gonzales. Now, Sarah Gonzales, if you don't know, she is an undergrad student at Cal State Fullerton, California State of Fullerton, right?
Yeah.
Or UC? No. Cal State Fullerton.
Yeah, that's the same thing.
Yeah. She went to community college first, and then she transferred in with a kinesiology major. She just started her kinesiology path, really interested in physical therapy school. She saw my YouTube videos and was like, hey, Justin, he messaged me and said, hey, can I interview you because this is something that I'm interested in, and I also need to do this for class. And I'm all about efficiency, so I said, why not?
Yeah.
Here we are, Sarah. I'm going to let her introduce herself, and then we'll get to it. This is an interview where she's interviewing me this time, so it'll be a little bit different.
Perfect. So, like he said, my name is Sarah Gonzales. I'm a kinesiology major at Cal State Fullerton, and I will be applying to APU in a few years. So, I'd love to learn a little bit more and learn as much as possible. So, I have a smooth transition from a 4-year to DPT school. So, I'm going to ask you a few questions on pre-DPT, on what you did to prepare for it, your interests and stuff like that, and then we'll go into some more in-depth questions. So my first question is, what made you want to get into physical therapy?
This is a really, really great question. So physical therapy, it kind of was like a hidden gem for me. I didn't really know about it. I knew it was like a doctorate program. Like when I was thinking about it, and I was like, okay, I could strive for something, like good, like a doctor. Like I'd love to be a doctor.
Yeah.
Of course, my parents had some influence with me. Like, you must be a doctor. I was like, But I transferred in, I started learning about kinesiology. Oh, there goes the lights.
Yeah,
There we go. Sensor.
Okay.
I learned about kinesiology, and then after that, I took a course on corrective exercise,
Okay.
and that's when I was like, wow, like we can do so much with helping people with just simply exercising, learning about the body, about muscle imbalances, about how we can influence people with just physical things, like without medicine, without having external factors, with just literally moving can help disease prevention, different diagnoses and things like that. So like I saw a lot of power with what we can do as physical therapists to help really impact and change lives.
That's perfect. Awesome. That's actually really great because I've always I've also had migraines, growing up. And so like I've had tension headaches and like other things. And I'm like, I don't constantly want to be taking medicine for this. What external things what more beneficial and healthy ways I can do this.
Right.
So did you always want to be, or since like that's kind of off of your hidden gem thing, that was something you learned from the corrective class, correct?
Right.
So that really kicked it off for you.
It really kicked it off. And then really learning about kinesiology just in general. Like I worked out my whole life, but I didn't know like there was a subject in exercise or subject in like human movement. I just thought like, people go to the gym and people just know like there's like a exercise bank. Okay, these are for your biceps, these are for your chest, and that's it. But I didn't know that there was actually a science behind like the forces that are applied on your body, whether it's free weights with gravity or with a cable where it's going in this direction, and how you can manipulate those forces to add stress to your body. And then that stress is your body responds to that, and then it builds stronger. You become more athletic, healthier. Yeah, all of that. Your bones get stronger. Like all these different things. Like I had no idea that there was a science behind that. Woo! We're gonna be doing that a lot here, so I guess this sensor is no good. So distracting. Sorry, you guys. Thumbs up for that one. Oh yeah. Like, woo! Yeah. We'll break down to dance. You guys know I love to dance.
Yeah, me too. I was a dancer, so.
Perfect. We'll do that a little later.
Yeah, for sure.
But yeah, so just the science behind it that has really opened my eyes and really was like, wow, like I can really help so many people after learning about this field.
Yeah, perfect, awesome. So what are a few things that I should know about going into DPT school? I know you've reiterated this in several of your other videos that I have watched, but what are some major bullet points that you would really put an emphasis on for an undergrad like myself?
I would say, I guess, just were you asking what to prepare for
Yeah, so
or
like what are
anticipate?
things, yeah, I feel like I take that back. And ways to prepare for it. So like that's a better way to put this. Some things that I really should be prepared for going into DPT school. You have mentioned a few, like really know your anatomy, brush up on some phys, brush up on some bio.
Yep.
So would those be like considered some of your main bullet points? Any like non-academic things that I should be aware of beforehand?
Yeah, that's definitely a loaded question because there's a lot
Of
a lot of differences. But yeah, I'll definitely share with you on some of those things. I would definitely say your anatomy is going to be huge because that's your fundamental. That's like your subtraction and addition in math, and then you need that to build onto algebra, right? I know some of you guys, math is not a strong subject, but not me. Woo! You got
I got this time.
Good
I was
job.
like, screw it. If this is gonna happen every 2 minutes, I'm here for it.
Let's do it.
Yeah.
I would definitely say know your anatomy because
Okay.
that's gonna be like your structural foundation. Like you need to know the origin insertions of your muscles.
Okay.
You need to know the landmarks of the bones. So like each bone has different landmarks because those are where muscles attach, or those are the places where you're gonna have to palpate and touch as a physical therapist. You need to know that stuff.
Okay.
You need to know where the nerve runs through and which nerve innervates what muscle. Because when nerves are affected, like let's say you have numbness and tingling down your leg or down your arm, you want to know which nerve that is and where the nerve root comes from. Or if certain muscles are spastic or whatnot, and maybe it's nerve or tension related, you need to know, like, all right, maybe I could be more specific to try to treat that specific nerve rather than just shotgunning it and like saying, well, let's just treat all the nerves and then see what happens.
Okay.
So like just being a better clinician, you want to, I think just knowing that anatomy background and having that strong foundation is going to be huge.
Okay.
Yeah.
So for my next question, is a DPT student, do you get to choose like a focus? I know that I've already met with an advisor at my school, and I asked her, I was like, hey, like, you know, what's like a good way for me to get in and, you know, like to cover my bases? And she said, well, have you chose what's it called? Not a focus, a concentration. Okay. Have you chosen a concentration yet? And I said, no, because I just transferred here. I don't know what I'm doing. Yeah. And so she was like, oh, well, you can choose exercise science as a concentration. And that's familiar with me. I also know that you are a personal trainer and you have been, you know, working out most of your life. Is there like a concentration within DPT school? So like, is there like, you know, a nerve section or a neural section or an exercise section? Like, is there a concentration within DPT school that you can focus in on?
Well, in APU's program, you actually don't have the opportunity to choose a concentration.
Okay.
It's just a straight course that they kind of lay out for you and you just go through it.
Okay.
Different programs have different concentrations that you can kind of focus in on, like business, exercise, ortho,
Within
neuro,
DPT?
within DPT.
Okay.
Some programs are a little bit different, so you know you're gonna have to research on which programs have those kinds of specialties.
Okay.
But there are subcategories or sub-subjects, I guess, in physical therapy. So you have your ortho, neuro, pediatrics, or like kids. You have cardiopulm. This is an area that I didn't know like physical therapists help, you know?
Yeah.
Vestibular.
what that was.
Yeah, cardiopulm. Like, what is that, you know? So that's like when patients have like congestive heart failure or like heart attacks or any kind of arterial issues. Like physical therapists could help out with that because as you know, arterial issues, if there's a complication, then that also affects physical movement, right? Physical exercise, and we're specialists in those areas as well. So we want to make sure that people are moving right and correctly, getting it in and out of bed, walking properly, and all those different things. So yeah, I mean, there's a lot of different specialties, and when you get into school, you also learn like there's even more special categories like women's health or pelvic floor or sports,
Okay.
vestibular, so like stuff like with dizziness, migraines, spine. Like there's like a lot of different areas that you can focus in on and like specialize if you want to.
Okay. Cool. So I guess yours would be like exercise, right? So like, was that something you want to do after? You want to do that after, for sure.
Yeah, like I think I definitely want to have exercise as a big part of what I do. 1, 2, 3. Woo! Oh my gosh, this is really distracting. Sorry, you guys. Exercise is something I really enjoy doing, and I think it really converts over into my physical therapy practice, you know, or when I work as a physical therapist. I think definitely exercise and fitness is something I want to incorporate in my practice, along with specializing in ortho. That's kind of my biggest like love right now in physical therapy.
That's cool. So do you have a preferred practice you'd like to get into after DPT school? Would you rather private practice or a group practice?
Yeah, so I've been really thinking about it. Right now, for those of you guys who are following me and doing, I applied for residency. I am currently waitlisted, and I haven't told anyone about that yet. So I'm waitlisted in the program that I applied to. So maybe I'll get in, maybe I won't.
I would say congratulations.
Yeah, it's kind of like a half congrats, yeah.
Not yet, but
Yeah.
still.
It's a
That's
teaser.
awesome. Yeah.
So if I get in, then I'll definitely do that. It's a residency for orthopedics, so that's kind of the area that I do want to get into. I think in my personal, just like what I envision is I would want to practice in any kind of orthopedic setting, whether it's private practice or in the hospital orthopedics, so I can just get that experience. And I think eventually I'm gonna want to branch out and have my own private practice or cash pay or anything like that. But also definitely incorporating fitness with it as well. 'Cause that's my passion too.
That's something I want to do too. I like that, just staying like active as possible.
Yeah.
So as a DPT student, do they teach you a wide variety of methods for rehabilitation? Yeah. So do these methods also change with technology? Does that have anything to do with the things that you guys learn?
Technology, what do you mean by that?
So like, I know that I mean, they do further research, kind of like how you were the guinea pig for a doctor the other day.
Right.
So would they ever incorporate that in the methods that they are now practicing within physical therapy? Do you think they ever use that, or are going to use that?
Yeah, I mean, they incorporate a lot of that now. So like force plates and having that ground reaction force. When I was a guinea pig for the research study, I had like all these little sensors on me.
Yeah.
And then when I was picking up something, like all those little sensors were able to catch like the degrees of those specific landmarks of like where I'm moving. So you have a lot of movement analysis. You can slow things down, and even like on your phone now, there's a bunch of apps, or even the slow-mo. Like you can use that technology to just watch movement in a slow version. So like when someone's walking in gait, you can really break it down into all those different phases and be like, wow, like they are really pronated in their loading response, or when their foot is going down, like their foot is just crashing. Like no wonder they have foot pain.
Yeah.
So like, yeah, I think technology can definitely help us. I don't know. I know that they are growing in like the virtual.
And like the study of it.
The study of
how
it.
they would apply it within actual rehabilitation, right?
Right. So they're growing in that area. I don't know how much of it is getting to the I guess the world with like the virtual, the VR kind of stuff. But I think technology, as it grows, it can definitely help the physical therapy profession.
Okay. So this kind of answers my next question, but I'm going to ask it anyways. This is, do you think exercise PT is more beneficial for sports-related injuries? So I know you kind of already, like, that's my specialty, that's what I want to go into. I also think it's very important that, try to use a lot of strengthening stuff when you are trying to heal injuries. So I think especially, for athletes especially, they also have this experience. So, I guess that's another way of strengthening an injury, especially a sports-related injury. So we can kind of over that.
Yeah.
Does the method of therapy change based on the severity of an injury?
Definitely.
Yeah.
Yes. Yeah. This is for sure. This is something you'll learn way more in depth in physical therapy school, but probably in your kinesiology program, they'll talk about like grade 1, grade 2, grade 3, sprains, strains, and things like that, right? Which are ligaments or muscles. And depending on that, like if it's like totally torn, then like maybe you can't really rehab something because it's just torn, you can't do anything about it. But if it's like kind of partially torn, then yeah, you could work on strengthening that muscle, strengthening the muscles around it, things like that. And then yeah, if it's something that's acute versus like something that you just got yesterday and you're like, I could barely walk, versus having it a little bit more chronic, like 3-4 months down the road where you're able to walk, but now your movement is just kind of dysfunctional, then we can fix that stuff.
Okay.
So it depends on where you are in your timeline, and then where where the physical therapist comes in and then has to choose the right plan for you at that right time that's specific for you.
So that would kind of go off of like, what if somebody had like an ACL surgery? They just got out of surgery, they've, had a few weeks of bed rest, and now they're ready for PT. Like, you wouldn't just jump in, all right, let's do some like squats or something.
No.
You take your time.
Exactly. And those are the things that you're gonna learn in PT school. It's like, well, some rehabilitations or some post-surgical stuff that happens. There are certain what we call contraindications like at that time. So like if they have a total hip replacement, like in the posterior approach, you want to avoid certain movements like bending the knee past 90 degrees, or turning your leg in, or crossing your legs over, because that might influence the surgery and then have like make that joint pop out or something. Yeah, exactly.
Loosen a screw or something.
Exactly. So you have to be able to know all your guidelines as well, and then know like when to progress, when to regress, and then when to really push the patient past their comfort zone. So it's kind of like a art. I haven't experienced that because I've just been working in only like 10-week rotations, and then I had to stop. So I never really had a long-term patient, like a post-ACL that takes at least like a year, right? And so I never had that experience. So when I get my first like ACL rehab, it's like, ooh, like this is gonna be fun, Like I get to really
the experience. You really learn from it,
Yeah, exactly.
Cool. So with this research that I did, I researched a few articles. I had one, which you actually mentioned in the beginning, which I thought was perfect, where exercising, prevents diseases, as you get older, and daily exercise, benefits you completely, like you stay healthy and strong. But based on that guideline, but I also have another one on hamstring strains. And I asked, with a grade 1 hamstring strain, will we go straight into exercise PT or include other methods?
So grade 1 is something that's like, I mean, you can still probably walk on it. It might be like, oh, like I feel something a little there, but I can still participate in my activities. Typically a strain happens because you use it and then that muscle wasn't ready for the amount of load that was put on it. So like usually people who are sitting all day, not really exercising, and then they go for a sprint, and then you'll hear, oh, my, like something in my hamstring like kind of hurts. Like that's pretty common. So if it's like a grade 1, definitely as a physical therapist, you can come in and you can help work on, depending, like we talked about, that timeline. That timeline, yeah.
Every time I stand up.
You're like Patrick.
Yes, exactly. I was just gonna say that. Like, I feel like Patrick Star. I'm like, Squid's just gonna walk in right now.
Oh.
Yeah.
What are you guys doing? Yeah. But yeah, like it just really depends on that timeline where they're at, and then where at the you as a physical therapist can really determine like, can I really help this person? Are they PT appropriate? Versus like a grade 3 where they're like totally torn, and it's like, they're not really PT appropriate because I can't really do anything for them. So then that's, if they come to you first, then that as a PT, you have that responsibility of saying, hey, maybe let's refer you out to your primary care physician, and so we can get additional lab work done or imaging done to really confirm if this is a torn hamstring, and then maybe talk about further steps like surgery or anything like that.
Okay. So with that, I mean, that's obviously like the rerouting, and that's kind of our call, especially with like the diagnosis kind of. So in that case, if there was like a grade 3 and it's like complete deformation, it's pretty bad, and they have to go to the extent of surgery, would you recommend, or would you personally still use exercise PT, or would you try, I've seen water therapy, and I've seen cold laser, and I've seen like a few other things, and I think you even mentioned, what was it? Ultrasound, yeah. So like, would that be any factors in this person's rehabilitation if they had grade 3, had to get, surgery, and it was a more severe injury?
Right. If it was grade 3, typically you'll see like a huge indent, like you're just like, whoa, that doesn't look right. Like, there should be something there, and it's just like gone.
Like a cave.
Yeah, exactly. Or like you'll see like biceps, you've seen bicep tears, and it just kind of goes up, and then like this bulk that's here is like completely gone. And you're like, that doesn't really look right. And so I think it's kind of a team effort, because you want to be honest with the patient. You want to tell them like, hey, this this doesn't really look right. You might have a torn muscle there. Probably what we can do is we can refer you, and they'll give you imaging, and then they'll kind of confirm if it is torn or not and the degree of it. And probably after that, they might have you go into surgery. Is that something that you want to do? Because some people want to opt out of it. Like they're kind of afraid, or they just don't want it, or they don't have the finances or whatever, And so then sometimes they just have to deal with that torn muscle, unfortunately. But then you as a physical therapist can say, okay, well, if that muscle is torn, let's work on other muscles that can help support that or help do the same function of that. So this is where anatomy comes in. So like a hamstring is a hip extender and a knee flexor. And so if like one part of the hamstring is torn, then you can try to work on the other hamstrings or other synergists like your glutes or your gastroc to help do those same movements. And then you also want to try to incorporate it so it fits into that person's life. So if they're working and they're like, my hamstring, I need that flexibility to like reach down, then it's like, okay, then we want to work on flexibility to do that and to minimize your pain. Or if they have to do functionally like walk or run or whatever, then we want to try to match that as much as we can. That's what physical therapists really try to do, is try to get them back into their function and get them as close as to where they were at least. So we call that prior level of function.
Right, because it never really returns back to its original state, especially with that extent of an injury. It's, you can get it back to as much as possible, but Right.
We want to try. Yeah, we want to try.
We're doing our best here.
We're being hopeful.
Yeah. So we actually mentioned this before. Actually, you mentioned this before, that E-stem and cold laser isn't necessarily a method. What did you call it again?
We call it more of like a modality.
Modality.
I think they changed the name of it now. It's like I forget, some kind of, I think they call it like a scientific agent or something like that. But when I learned that it was called modality.
Okay. And so in that case, like, it wouldn't be, but it would be a resource within rehabilitation, right?
Yeah. So people still use that today. People use ultrasound. You mentioned cold laser, water therapy, things like those are all different methods that you can do to help rehab somebody. And if it works on them, then it works on them. Sometimes even just talking to people will heal people because they feel comforted. Yeah, there's a lot of research to show that, to have that alliance, just that
psychology of it.
That psychology of it. Exactly. It, like all of that. It's just like, and who knows if like that thing is actually working, But, if they feel like they feel better, then they feel better. If they feel like they can function better, and even if research doesn't support that, but just because you're doing it and they feel that it helps, then I mean, why not?
Yeah.
But of course, you want to have a purpose, and you want to also be able to validate everything that you do in physical therapy. We don't just do something just because, right? So you want to validate that.
Okay.
But I mean, if it helps them, and if you can back that up with the research as well, then I would say go for it.
Okay. Yeah. Well, you answered all my questions and everything that I really wanted to cover. So
Perfect.
I'm happy. I'm happy. This is awesome.
Perfect. So I actually do have a couple questions for you
Perfect.
since you're on this channel and in this
Yes.
video.
Yes.
So Live for Change is all about fitness, physical therapy, and lifestyle, right? So I like to ask, what is your favorite exercise?
Like muscle group or like a specific exercise?
A specific exercise.
I would have to say, well, could you help me out with that? Like, what would
Sure.
you like consider?
So like a squat,
Okay.
a shoulder press, like let's say you like to use the cable and you like to do rows on that, lat pull, any of those.
I would definitely have to say squats.
Squats.
I love squats. I like, last summer I took a, what's it called? It was like a fitness class. It was strength training. I took strength training because growing up I did dance. I actually had a really bad sports injury going into high school. So my mom didn't let me go back to soccer, but she let me go back to dance. Okay. But with soccer, they did weight training. And with dance, you just dance. Like, it was cardio style. You do it over and over again until you pass out.
Jazzercise.
Yeah. So that was my thing, is like, as much as I worked out, it was mostly cardio based. Okay. And so I never really knew how to lift weights. I would go to the gym and I'd kind of feel insecure. And I was like, I got to college and they were like, this is a class. And I was like, no way, let me do it. And so I did it and I loved it. I loved barbell squats. That was my favorite.
Back squats?
Yeah.
Nice.
Yeah.
What do you like about it so much? Like, why does it intrigue you with that specific exercise?
So for me, I actually felt stronger when I did it. Also, when I did strength training, like obviously my upper body was very weak and my lower body was much stronger. So I felt more confident. It was a confidence thing for sure, as well as it was like, I can build on this. I feel confident with this because of my confidence. And I think my max was like 215, and like that's where I kept. It's not even that much. Yeah, I know. Like Shorty coming in thick or whatever. But I mean, like, it was just like because I believed in myself enough to do it. I think it was a psychology thing. However, I have been working on my upper body, and I'm starting to feel more confident with that. However, I still love barbell squats, and I also love, as this weird as it sounds, I love that pain of like, I can do one more. I know I can, and I'm like, and I will do this until I fall. Yeah. So I think that's what I like about it.
No, that's really awesome. And with like exercise and things like that, when people are trying to get into the gym, I think there's a lot of like people get confused sometimes. Like, what exercise do I do? Like, I saw all these exercises for legs or for upper body, but my biggest advice is to always say, work on what works for you. Like, if you love squats, do squats. Like, if you want, like, there's so many different exercises that you can do for legs. And that doesn't mean squats is the only option. Like, I think people think you have to squat to get big legs. Like, that's not true. Like for me, like, I can't do squats because my back really hurts when I do that. So I stay away from it.
You have alternative.
So I have alternative exercises, and that's exactly what you'll learn in your kinesiology program of different exercises and how these exercises work these muscles and things like that. So I really encourage you to continue to exercise, continue to build that strength in your upper body, but also focus on your strengths where it's like, dude, if you're already lifting over 200 pounds in your squat, keep going, girl. But of course, make sure it matches up with your fitness goals as well, because there's different reps and sets and all of that like really changes depending on what your fitness goals are. I kind of want to ask you to show me your squat. I kind of want. Nah, you're wearing jeans. You're.
I mean, she's not that flexible in these. She can't get that.
Okay. Maybe the next interview I'll warn them and say, hey, wear some shorts or something more flexible.
Like, let me see it.
Yeah, let me see it. Yeah, gotta show it. Yeah. All right, you guys. Well, Sarah, I thank you so much for being on this video and really inspiring a lot of people who are watching here. If this video helped inspire some self-change, go ahead and comment below on how it has done it, or go ahead and encourage Sarah and tell her, like, hey, you can do this. You're going through this journey to get into physical therapy school, and I know that your story will help inspire so many people out there. So I just want to thank you for taking this. No! Maybe it's not done.
Okay.
Oh, it's like, oh. It's like, all right, you need to get out of here. Yeah. well,
squeezing this
taking
out.
this time to just meet up together and do this video and help create more content for all of you guys who are watching. So thank you so
And
much.
thank you for answering all my questions and educating me further.
You're very welcome. I have something for you.
Oh, ooh, how exciting!
Yeah.
I see plastic in my name.
So everyone who comes on the show, who does an interview, I always like to give them a little bit of merch. So you're welcome to open it, yeah.
Oh my goodness!
I hope it fits. If it doesn't, let me know. We can always exchange it.
Oh my
But
God, this is awesome.
what you get? Lift, baby.
Lift.
That's right. She's trying to lift for change.
Thank you so much.
You're welcome. You're
This is
welcome.
awesome.
Well, you guys, I hope you guys learned something from this video and I hope it inspired some self-change. Remember, change people. That's why we live for change, people. Have a great one, you guys.
That's awesome.